10 things to look for when you have ED and considering going to the doctor's office. Today, we're going to talk about evaluating a doctor's office or clinic to go to when you have sexual dysfunction or ED. First of all, I know that all you have to go by is on their website and the reviews. But some of the questions that you should be asking the clinic that you're considering about going is that I have 10 things that you can look for when you are considering a sexual health clinic and going there for evaluation. So, number one, is it run by a board certified medical doctor? Medical doctor have the degree of either MD or DO, and mainly sexual medicine is done by a urologist, but not all urologists do sexual medicine. Sexual medicine can also be done by multiple specialty as well. I'm a pain management doctor, and that's what my specialist. But since in the last 15 years, I've been specializing more on sexual health and particularly regenerative sexual health. And I've been asked to talk all over the world about this, as well as be writing a book internationally on regenerative medicine for sexual health. So you want to look to see if it's run by a board certified medical doctor, and if that doctor is going to be seeing you personally in your initial evaluation. Now, the shockwave and the treatment may be done by their assistant, but the evaluation should be done by the physician in charge. Number two, is that clinic do any type of assessment or questionnaires to evaluate for the state of your ED? Are they using an IIEF ED questionnaire, or are they using questionnaire for your testosterone level, or the ADAM test, ADAM test? Are they asking questions about whether you've taken hormones in the past as well? And are they doing a questionnaire about your prostate health, such as the prostate evaluation test? That's what we do in our clinic, is that we have standardized questionnaires that patients fill out before their treatment and during the treatment. That's how we're able to gauge the improvement. So that's number two. Number three is look to see if they do blood work, comprehensive blood work that look at all your hormones from your head to your genitals, as well as looking for inflammatory factors that may be contributing to inflammation in your body, which then contribute to poor blood flow as well. And I've done a previous episode on blood work on ED that we'll put in the show notes that you can review at the different blood work that I actually recommend for you to get for sexual health. But blood work is important because that will really look at inside and see what's going on in your body inside, not just on the outside alone. And the doctor that's evaluating you should be looking at you from head to toe, checking out your glands and listen to your heart and your lungs and the whole body system, and checking out your pulses and your skin to see if there's any other concurrent medical condition that may be contributing to your ED presentation. The fourth thing to look for is, are they able to do a multimodality approach with you? Because what I see a lot of sexual health clinics is that they just do shockwave therapy alone, or they just do hormone alone, or they just do platelet-rich plasma alone. It's like, if you're gonna go to a chef, well, a chef can cook you a nice gourmet meal if he has multiple tools or multiple equipment that he can use to create the dish, right? But if all he has is just one pan and one spatula, you're not going to be able to make a lot. When you go to a sexual health clinic, do they have a shockwave available? Is it focus? Is it radio? Are they able to do blood work? Are they able to do platelet-rich plasma? Are they using supplements? Are they able to do evaluation of your nitrous oxide level as well? Are they giving you a pump to use? In addition, in our clinic, when patient comes in, they get comprehensive blood work, they get the questionnaire, they get supplement, they get a penile pump, they get an evaluation by a medical doctor, and sometimes we'll also do a penile Doppler ultrasound. That brings me to number five. Is that clinic able to do a penile Doppler ultrasound or not? Because that's critical to evaluate to see if you have adequate blood flow to the penis. Well, number six, if they are doing platelet-rich plasma, what volume of blood are they getting out of you? I recommend in order to really get enough stem cells in your platelet, you need to get out at least 60 cc or milliliter of whole blood. Usually, when you do platelet-rich plasma, the blood is drawn from your veins, and the adequate amount you should get is 60 cc or 60 milliliter. That will equate to about 2 ounces or glass of wine. If the clinic is doing about only 11 cc or 22 cc of blood, you're not getting enough platelets to allow you to get more blood flow or even cell growth. So the volume of whole blood is important. In our clinic, we get out 120 to 180 cc of blood depending upon your medical condition as well as your age. So we give you twice as much a stem cell as you need, sometimes even 3 times as well. That's number six. And number seven is, are they focusing on lifestyle approaches to recommend for you to restore your sexual function? In addition to the treatment, are they recommending a diet and exercise regimen as well? Too, in my clinic, we have an app that will help you track your sleep, your hydration level, as well as helping you adhere to a Mediterranean diet and also keep track of your exercise level. Because I believe that in order for you to heal from ED, you have to heal from the inside out. And that starts with diet. All right. And then number eight is hormone replacement therapy. Are they able to do hormones replacement therapy if you have low testosterone level? And is it in the pellet form or in injection form? The best form to receive for testosterone replacement is either pellet or injectable, though pellets is more bioidentical with less side effects. And with pellet, you get daily testosterone versus when you do injection. If you use testosterone cypionate, you peak at around 24 hours. It stays for about 72 hours. And then when you do injection, you get peak level and then low levels like that. So often require you to get twice a week injection. I personally like the pellet form better. It's more steady blood level and less peaks and valleys and less side effects of conversion to estradiol. Number nine, are they following up with blood work? When you have ED, as you get better or you're getting hormone replacement therapy because you have low testosterone, make sure that you get blood work at least once every 6 months to look to see if you have high red blood cells or maybe any liver abnormality, and to measure your hormone level and to adjust accordingly as well too. And that's important. And then when I see patient and they're on hormone replacement therapy, we look at the blood work in the first year 3 times a year, and then in the subsequent years as twice a year. And last, number 10 is how many patients have they treated, how many testimonials they have. We treated over 7,000 men in the clinic with ED. We have proprietary Get Hard system to really restore your sexual functioning again for you to get out of ED. But the bottom line is that I want to give you this framework to evaluate a clinic as you are searching for a clinic for treatment. And this is the approach that we take, that we do a thorough assessment, use standardized tests. We have a method of evaluating, and we don't use a cookie cutter approach. Everyone is evaluated on individual basis. Everyone has a different treatment plan because not everyone is the same, right? And our approach is multimodality and looking at helping you restore your function again from the inside out. We do blood work to follow up on that. We restore your sixth system of the brain, the emotion, the hormone, the nerve, and the blood vessels and the muscle. And we have an app for you to follow. We have you use that even after you have achieved result with getting your erection back. Because ED is like weight loss. You do the hard work to get the result, but you need to continue the good lifestyle behavior, such as diet, exercise, and sleep, and stopping smoking and moderating alcohol and sleep, to continue the effect, so that way you don't revert back to where you were before. So it does take work, and it does take changing your lifestyle to maintain that. I've seen good result in our patient that does that, and I've seen patient that does not continue it and then they revert back to having ED again, but not as bad as it was, but they do see some changes. So having said that, I hope you find this helpful. I would appreciate it if you like, subscribe, and comment. Let me know if you have any question, and know that you can live your best life, be happy, love more, and do more. And remember, ED is the +1 problem. It's not just you alone. Having said that, I'll see you in the next episode. Hello there. Want an amazing sex life? This free gift is going to give you more sex by helping you get harder and lasting longer. Let's talk about the most sensitive subject, the effect that aging has on your sex life. If you're over 40, there's about 67% chance that you have to deal with one or more of these issues. You sometimes go soft in the middle of sex. You sometimes have trouble lasting long enough to climax. Your erection just doesn't feel as hard as it used to be, and your penis is not as sensitive as it used to be. You cannot reach orgasm or ejaculate. You sometimes have trouble getting an erection. These things lead to frustration and embarrassment when you cannot please your partner. My name is Dr. Ann Truong, and I've been treating men for issues like this for over 25 years. As a board-certified medical doctor who specializes in men's health, I helped over 7,000 men reverse the effect of ED. As a way to introduce you to the ED treatment that I offer, I want to give you the most incredible free gift ever. But don't let the fact that it's free gift fool you. This powerful gift will help you get harder and stay and last longer, and may just revolutionize your sex life, making sex more exciting, more thrilling, and an amazing experience again. How is that? So here's what you're going to get in this most incredible free gift. Number one, a good morning wood smoothie recipe. This is my specially formulated antioxidant recipe that will help you get harder and stay and stimulating more blood flow. It is formulated to increase your nitrous oxide level, which is one of the biggest keys to making you harder and firmer more often, and will also help you last longer. It is filled with lots of greens that create more nitrous oxide in your blood. This smoothie will give you that morning wood effect and will also make you harder on demand when you need it most. And you'll see the effect in about several weeks. Number two, nitrous oxide testing strip. You will also get 2 of these strips, which you will use along with simple instruction to test your nitrous oxide level in your saliva. Nitrous oxide is a gas in your body and is required for good blood flow to the organ. The strip can determine if your nitrous oxide are deficient, which can help us advise you on the best way to reverse your ED. Even more important, since ED is an early warning sign of problems with circulation and heart health, this can also be a great way to prevent heart-related problems such as strokes and heart attack. Number three, and the best part of all, a 30-day free trial access to the Modern Man Club. As part of our mission to make men hard again, we launched the Modern Man Club as a way to provide education and support to a community of men who's on the path to reversing their ED, with pre-recorded and live session being offered every week. I will help men regain sexual health through training, support. I will be there all the way with you to hold your hand through, so that way you can overcome ED and have your best sex life. Members rave about this session and the sense of community they gain by being a member of the Modern Man Club. And all you have to do is to say maybe to this offer. And once you say maybe, you will be on your way to a more fulfilling and exciting sex life. So all you have to do is fill down the form below, and then I will see you on the inside. Thanks for listening to the Sexual Health for Men podcast. If you love this episode, then please take a screenshot on your phone and post it on Facebook, Instagram, or wherever you post. And be sure to tag me and let me know why you like this episode and what you like to hear in the future. That will help me know what's great for you, and I would love to give you the most incredible free gift designed to help you improve performance quickly. go to my website at sexualhealthformenpodcast.com to get the book, The 5 Common Costly Mistakes Men Make When Facing ED. I would appreciate it if you subscribe, leave a review on Apple Podcasts or wherever you listen, and just know that you can have sexual vitality for life. I appreciate you. Until next time.